Hi, good evening. I am Dr. Nitin Verma, Associate Director Paediatrics with Rainbow Children's Hospital. I want to have a word with all mothers regarding newborn vaccines. We know that we are all going through very turbulent times. There is a real scare of a virus which is impacting the whole world. What do we do? Do we take the vaccine? Do we delay taking the vaccine? Is it safe to go to the hospital? How long can I delay? Are there any special vaccines which can be used? Let's deal with vaccines one by one. So when the baby is born, whichever hospital you are born on has its policies, and there are certain vaccines which are given at birth. These include BCG, hepatitis B, and OPV, or the oral polio vaccine. These will be administered wherever the baby is born. You would need to go back once on day 5 to have the baby examined by the pediatrician. This is to look at the baby's weight, whether there has been any loss, what is the level of jaundice, if any, and to see that the baby is all right. Thereafter, we have a window of 6 weeks. The first vaccine post-delivery is at 6 weeks, and this can be delayed by maybe about 15 days. So between 6 weeks and 8 weeks, we need to go back. Most hospitals have stopped normal OPDs and consultations and restricting babies coming into emergencies. However, we have resumed giving vaccines because some vaccines, especially in babies below 6 months, cannot be delayed too long. So the vaccines are given at intervals of 4 to 8 weeks, which means you may take them at interval of 1 to 2 months. Do check with your pediatrician and the hospital that you are going to, or the clinic that you are going to, whether they are taking steps to make sure that your baby and you and the doctor, of course, are safe. What we are following at Rainbow Children's Hospital is that we are running standalone vaccination clinics. The history is taken outside. The mother is screened to see that she has no fever. She is made to wear a mask, and you come into an OPD area where no normal patient is allowed to come. You are ushered in after your weight is taken to the doctor's chamber. The vaccine is administered by the doctor. You finish your consult, discuss what you need to, and you move out without coming in contact with anybody. Thereafter, the room is sterilized before the next baby comes. It is very important to have this protocol in place. If this protocol is not in place, try and take your baby to a center where this protocol is in place. Insist on it. In fact, your doctor should insist on it. So there are 3 sets of vaccines which are taken in the first 6 months at birth, and thereafter 3 doses. And these are important vaccines which include DPT, Hib, the polio, the pneumonia vaccine, and the rotavirus or the diarrhea drops. We should try and complete all these 3 doses by 6 months of age. We then have a window for some optional vaccines, and we'll try and make that up as much as possible. If the vaccine gets delayed for some reason, then discuss it with your pediatrician, and we can follow a schedule where we can catch up with these vaccines once you're able to go back. There are some optional vaccines, but really not optional vaccines. We give it to all children, and these include the influenza vaccine. All children should take it, and especially in these turbulent times. It doesn't help against the coronavirus, but it will help your baby falling ill and avoid unnecessary visits. So difficult times, stay safe, stay home, be in touch with your doctor, try and make sure that you take your vaccines on time. If times are bad and you're not sure, you can delay in consultation with your doctor. So once again, good luck, stay safe, stay home, and make sure that the vaccines are done on time. Take care.